Welcome to The Explainer. Today, we're going to zero in on the one skill that can truly make or break your SCA consultation, and that is mastering the human element. It's a really interesting question. You see doctors who know the medicine, they know the science, their clinical knowledge is absolutely rock solid. And yet, they still miss the most important piece of the puzzle. The piece you won't find in any textbook. And here it is. It's called the diagnosis trap. It's this intense focus on just one thing, finding that clinical label, getting the diagnosis right. And when you're so focused on that, you can miss, well, pretty much everything else. Okay, so let's really dive into this. This is where so many consultations go off the rails. And what's wild is that it's a surprisingly easy trap to fall into, especially when you're under pressure. All right, so on the surface, this seems totally simple. A patient comes in, they've got elbow pain, you diagnose lateral epicondylitis. Job done, case closed, right? Well, this is the perfect example of the trap in action. Now, this slide shows you exactly what I mean. Look at the gap here. On the left, you've got the clinical fact, lateral epicondylitis. But on the right, you have a human being. This isn't just a patient with elbow pain. This is a self-employed person who is currently out of work with a baby on the way. Two completely different pictures. And this is what happens when you get caught in that trap. When you only treat the diagnosis, your management plan can completely miss the mark. Suggesting a fit note for time off work doesn't just not help this guy. It actively ignores his entire reality. And that fails the patient, and it fails the assessment. So, what's missing here? It isn't more medical knowledge. It's a completely different kind of data. And it's data that is absolutely critical if you want to create a safe and effective plan. This is what we're talking about, the psychosocial context. You can think of it as the world the illness actually lives in. It's the context that changes everything. It's knowing that the man with tennis elbow is also deeply stressed about his finances and his growing family. That's the psychosocial data.
And then there's ICE. This isn't just a nice little courtesy, it's a vital part of your data gathering. What does the patient think is going on? What are they secretly afraid of? And what were they hoping you could actually do for them right here, right now? This is the absolute core of a patient-centered consultation.
Look, here's the crucial point. This stuff isn't optional. It's not a soft skill. Without this information, the psychosocial context and their ICE, your consultation is fundamentally incomplete. You're basically flying blind. So how do we get this data? Well, the solution isn't in another textbook or some complex algorithm. It's actually something you already have. This right here is the big mindset shift. Genuine, active curiosity is probably the most powerful diagnostic tool that you own. It's about having a real desire to know and learn something about the person sitting in front of you, not just their symptoms. And this just brilliantly illustrates the difference between working off a checklist and having a real conversation. Anybody can run through a list of symptoms. A truly great clinician asks questions that uncover the story behind the symptoms. Okay, so let's get practical. Let's talk about the actual tools you need to put that curiosity into practice. These are the kinds of questions that will unlock all that essential human data. It all starts with a simple approach. First, you have to open up the conversation. Then you let the patient tell their story. And your job is to listen, and I mean really listen, for the cues. A cue isn't always a big, obvious thing. It might be a phrase like, well, I was worried it might be, or just a subtle change in their tone, a hesitation, a sigh. That's your signal to gently dig a little deeper. It's so simple, right? And so open. This isn't what's wrong or where does it hurt. It's a genuine invitation. It lets the patient start their story wherever it feels most important to them, which, by the way, is often where the most important clues are hiding. This question goes straight for the psychosocial impact. And don't just ask it one way. Try a few variations to see what connects. Tell me what a typical day looks like for you now with this going on. Or what's the biggest thing you haven't been able to do because of this? This is how you find the story behind the symptom.
Now, this gets right to the heart of their concerns. For some people, being this direct is fine, but for others, you might need a softer approach. You could try something like, had you any thoughts yourself about what might be causing this? Or, sometimes when people have these symptoms, their mind can go to worrying places. Has anything like that crossed your mind? The goal is just to make it safe for them to tell you what they're really afraid of.
And this one uncovers their expectations. It gives you a clear, shared goal for the consultation. And again, have some variations ready. Aside from getting a diagnosis, what was the most important thing for you to get from our chat today? Or maybe, what would a good outcome from this visit look like for you? Knowing this completely transforms your ability to build a plan that they'll actually agree with and follow. Now, some of these deeper questions can feel pretty personal. As it says here, you can't just jump in cold. You need to build a little bridge first, and that bridge is called signposting. It is absolutely essential for keeping that trust and rapport when you need to talk about sensitive stuff. This is a perfect example for a sensitive topic. Just notice the 3 things it does. First, it explains why you're asking. Second, it clearly asks for permission. And third, it frames the patient as a partner in this process. This simple structure can be adapted for any sensitive topic you need to explore. So, when you gather all of this human data, the final part of the consultation, the management plan, is completely transformed. And really, this is what it's all about. You're not just treating tennis elbow anymore. You're creating a plan that works for a self-employed, anxious father-to-be, a plan that is relevant to his life, responsive to his fears, and totally unique to him. Ultimately, that's the question. And how you answer it will define your practice and determine your success in the SCA and way beyond. Mastering this human element, well, that's what separates a good doctor from a truly great one.